You've probably met or heard of someone who led a seemingly impeccable routine, maintaining an ideal weight, exercising regularly, and not smoking, but who experienced an acute cardiac event. This situation, which often occurs without any warning, prior symptoms, or discomfort, leaves family members perplexed and raises a fundamental question about how our own bodies function. In modern cardiovascular medicine, we increasingly understand that the simple absence of physical symptoms is no guarantee that there are no silent biological risks. Grab your pen and notebook and stay with us until the end of this video. Because in addition to thoroughly understanding this mechanism, I'm going to share a practical golden tip that will make a big difference in your prevention routine. Do you know someone who should watch this video? Then share it with them. Because up-to-date knowledge can save lives. Our heart is a tireless organ that works continuously, requiring a constant supply of oxygen and nutrients to maintain its vital rhythm. This supply is guaranteed by a complex network of blood vessels, most notably the anterior descending coronary artery, a vessel of extreme structural importance that nourishes a large part of the left ventricle. When blood flow in this vital region is compromised for any reason, the consequences for the heart muscle are immediate, directly affecting its ability to pump blood to the rest of the human body. It is precisely because of this anatomical importance that the continuous integrity of this artery needs to be assessed with high precision, going far beyond the most basic clinical examinations in a doctor's office. Over the years, the inner walls of our arteries, a delicate layer known as the endothelium, suffer constant microaggressions, caused by factors of our modern lifestyle and metabolic variations. Frequent spikes in blood glucose, chronic elevations in blood pressure, oxidative stress, and systemic inflammatory processes create small dysfunctions and lesions in this important protective barrier of our blood vessels. To repair these microscopic damages, our own immune system reacts, causing LDL cholesterol particles to infiltrate the arterial wall. Over the decades, this cycle of aggression and inflammation leads to the progressive formation of atherosclerotic plaque, composed of lipids, dead cells, and hardened calcium deposits. One of the most complex biological phenomena in this process is positive remodeling, an ingenious adaptation mechanism of our body to try to protect blood flow and tissue oxygenation. As the inflammatory plaque gradually grows, the outer wall of the artery expands outward in a compensatory manner, preserving the diameter of the internal space and allowing the free passage of oxygenated blood. This silent adaptation scientifically explains why countless people can maintain very high physical performance and perform intense exercises without ever feeling chest pain or any sign of abnormal fatigue. Cardiovascular disease progresses invisibly for decades, camouflaged by this anatomical remodeling, creating a false sense of security while the biological danger continues to develop in the deep arterial structure. I want to take this opportunity to ask, do you usually investigate the health of your arteries beyond basic routine exams? Leave your comment below, as this interaction enriches our community. The great revelation of current medical science is that the vast majority of acute cardiac events do not occur due to arteries that were already almost completely blocked and that would cause obvious physical symptoms. On the contrary, these collapses usually originate from much smaller and unstable atherosclerotic plaques, which block less than half of the vessel lumen and go completely unnoticed in the vast majority of conventional stress tests. These soft plaques have a core filled with inflammatory material and an extremely thin fibrous cap, which makes them highly vulnerable to rupture in the face of a sudden peak of physical, metabolic, or emotional stress. When this cap ruptures, the body reacts immediately by forming a clot to seal the wound, but this same clot ends up blocking blood flow in moments, transforming a free vessel into a serious emergency. This scenario highlights the importance of understanding systemic inflammation, not just as a temporary response, but as a continuous driver of premature vascular aging in many people worldwide. Guidelines from major health organizations indicate that managing chronic stress, improving sleep quality, and regulating metabolism are fundamental preventive pillars. When we neglect these factors, we allow the body's defense cells to transform into cells that accumulate in the arterial wall, silently accelerating the degradation and instability of the internal vascular structure. This is why contemporary medical assessment seeks to look far beyond the weight on the scale, focusing intensely on reducing this chronic inflammatory state that serves as the main trigger for the destabilization of dangerous soft plaques. Regular physical exercise, in this context, is not just a general health recommendation, but a powerful biological shield against the consequences of unexpected arterial blockage. Consistent and well-guided movement stimulates angiogenesis, the natural formation of new blood pathways, developing what sports medicine and cardiology call adaptive collateral circulation. These secondary pathways created by exercise act as intelligent shortcuts for the body, ensuring that oxygen continues to reach the heart muscle cells. Even if one of the main pathways faces difficulties or reduced flow, it's a fantastic way for our own body to build a reserve infrastructure. This improves cardiovascular resilience and increases the chances of recovery and survival in the face of any sudden metabolic or structural adversity. However, it is crucial to have a clear scientific understanding that in the event of a plaque rupture and sudden blockage of an artery, the medical response time becomes the most critical factor in all scenarios. There is a maxim in emergency medicine that states, time is muscle. Every minute of interrupted blood flow represents the loss of vital cardiac cells. Damage begins to become irreversible within just 20 minutes without oxygen. This makes the speed of diagnosis and hospital treatment a completely decisive and paramount aspect for the patient's future. Rapid intervention with modern procedures, such as angioplasty and stent placement, can unblock the artery with millimeter precision. This restores essential blood flow to the cardiac tissue for its immediate preservation. But modern medicine has undergone a true technological revolution. The focus has shifted from treating established disease to fully embracing precision prevention through advanced imaging and data. Coronary calcium scoring allows doctors to visualize and quantify the accumulation of calcification in the arteries in a quick, painless procedure. Furthermore, computed tomography angiography can accurately map soft plaques invisible to traditional methods, which represent the greatest risk of sudden rupture. This paradigm shift means prevention is no longer based on generic statistics, but on real and individualized anatomical data for each patient. Mapping biological risk long before any symptoms appear transforms an unpredictable fatality into a mappable, highly monitorable biological condition. By identifying atherosclerosis in its earliest stages, the medical team can optimize strategies involving fine-tuned nutritional adjustments and stress management. Specific medications with strong scientific evidence are also used. Health is now an active commitment to protecting our cellular biology. Continuously and intelligently investigating our health is the key. Now take note of today's expert golden tip. Our golden tip today involves how you prepare garlic, a food widely studied for its beneficial properties in protecting the vascular endothelium. Raw garlic contains a compound called allicin, which helps promote vasodilation and reduce oxidative stress, but allicin is only activated when the garlic cell walls are broken. The metabolic secret is, instead of chopping the garlic and throwing it directly into a hot pan, crush or chop it and let it rest for exactly 10 minutes at room temperature before subjecting it to heat. This biological pause allows the enzyme alliinase to produce allicin abundantly. And by heating it after this rest, you preserve a large part of these protective compounds for your arteries and your heart. If this content is expanding your understanding of preventative healthcare, subscribe to our channel now to continue receiving valuable information, and don't forget to turn on notifications so you don't miss a thing. Share this video with your family and friends right away, because providing clear and well-founded information can be the first step in encouraging someone you love to seek proper preventative medical care. A big hug from your friend Robert Tournier. See you in the next lesson with more valuable tips. Bye.